I'm from the United States. My feelings were not hurt by the negative comments about our healthcare system. It is a terrible model, and I will not be speaking about it today. But what I will be discussing with you is very important. I'm from the Siemon company. We're a manufacturer of IT cabling, so copper balanced twisted pair, optical fiber. This is the backbone over which all of the IT technology that you were discussing is going to operate over. I don't know if there was a problem. He was waving. Okay, so I really want to spend the next 15 minutes talking to you about how important it is to have a capable cabling infrastructure in place to support all of the IT initiatives that we've been discussing. What's absolutely phenomenal from my point of view Can you go to the next slide, please, or correct this? From my point of view, what's absolutely phenomenal is that India's objective is to be in the top 3 healthcare providers globally by the year 2020. This is absolutely astounding. 1/6 of the population is here in India, and the objective is within the next 4 years to provide all citizens with free drugs, diagnostic treatment, and insurance for serious ailments. To achieve this objective, India needs to install 600 to 700,000 new beds within the next 5 years, 3 million new beds by the year 2025. And this is not only to serve the India market, but also the industry of medical tourism. We have in India the best, most capable network of doctors in the world, but the cost is 1/10 than if you were to go to the United States or if you were to go to Western Europe. So this is what's driving the explosion of this market. A couple of statistics. The market for healthcare is growing at 17%, but the market for telemedicine in India is growing at almost 30%. And the reason for this technology is really threefold. There's 3 things that you're trying to achieve with telemedicine. The first is to support outsourcing of pathology, laboratory testing, and so forth by foreign countries. And this is done because the cost differential in India is so favorable. The return on investment supports radiographic readings, x-ray readings, mammography readings, medical diagnostics being done here in India. The second cause for this explosive growth is the investigation of robotic surgery, and this is key to bringing medical services to the rural population here in India. 70% of the Indian population is in rural areas, but those rural areas only have access to 3% of the specialists. So we have this fantastic growth in the healthcare sector. We have this explosive growth in telemedicine in India. But what's surprising is that in India, the growth of the IT spend is only 9%. So we need to ask ourselves, is that enough? And I'm going to tell you right now, and as you'll see through this presentation, the answer is absolutely not. This IT spend needs to at least double. And the reason for this is that we need to support a core infrastructure within our healthcare environment and within the clinics. This starts with the data center. The data center is the area where we store data and process data. This may be customer-owned or it's cloud-based, but it must exist within every facility. This is the brain. And from the brain, we transfer over to the spine, the backbone of the network. This is this area right here within the building, which connects the data center to the floors of the facility, which are called the horizontal. You can think of that as the arms of the cabling network. And at the end, that supports to each of the work areas. The work areas is where the technology or the technological data is generated. So looking at these different areas, the work area, this is that 2 million bed location. This is the location where robotic technology takes place. This is the area where surgery takes place. Types of things that happen there, medical records, imaging, Computer on wheels. In the United States, we can have 12 unique services associated with each hospital bed for all sorts of monitoring activities. Each of these devices in that work area connects to the horizontal cabling. There is one structured cable, one telecommunications cable for each device in the work area, and it goes to a location on the floor that's called the telecommunications room, and in there we have an area of aggregation. So aggregation connects the signals on each of these different device locations and brings them down to the main telecommunications room where we go ahead and connect to the data center. This is hierarchical. We need at a minimum in the work area to support the data throughput needs of the technology. We need 10 times faster communication to support aggregation, and then we need to deal with that technology, process it, conduct the analytics in the data center. So I keep talking about speed, I keep talking about effectiveness. So I want to share with you a couple examples about the technology that the structured cabling infrastructure supports. Take the most simplistic, take a 16-bit mammogram. This would be the equivalent of a digital X-ray. Ethernet is the language that we use to move data, and Ethernet is available in a variety of speeds, from the slowest speed, 100 base T, to the fastest speed, 40G base T. It's pretty easy to move a digital mammogram around, on the order of basically half to 1 second. But what happens when we start moving more sophisticated technology, PET images? Now we're talking about maybe half a minute. This level of technology, this type of speed, is the fastest that we can support with handheld mobile devices or with wide area networks. So if we want to be communicating between facilities in a timely manner, we're basically limited to the type of files that we can support. When we talk about sophisticated diagnostics within the hospital, when we start talking about CT scans, when we start talking about combined CT PET scans, these are very small images, 1 centimeter by 1 centimeter by 1 centimeter. We're talking about files that might be 40 gigabyte in size. Now start taking a look at how long is required to move these files. If you don't have a sufficient data center in place, you've got a doctor or a medical professional waiting 1 minute, 2 minutes to load that file. There's a cost that's associated with this, and it's this cost that justifies the speed and the capability of the IT network. If we have an IT system that doesn't perform, we're actually auto-negotiating down to a lower level of communication. That needs to be repaired. We need to have a cable that's pulled, that's replaced. We have a workstation that's down. It can take an hour to repair that cable. What does an hour cost? Well, it's pretty easy to go ahead and deduce. There's a fantastic study by the India Brand Equity Foundation. Predicts that in the year 2020, each doctor, each nurse will be responsible for $100,000 US worth of revenue per year. That translates to about $50 an hour, which transmits to about $1 a minute. So you have to ask yourself, how long is the typical medical appointment? How much is it going to cost to wait a minute? How much does it cost to wait a minute in the surgery suite? A couple other decisions that are about data centers. Now, as I said, data centers can either be customer owned. This is where the equipment is housed in the organization, where it's managed by an in-house IT department, or it can be a cloud data center, which means it's hosted off-site. Off-premise computing is done somewhere else, and services are outsourced to third-party clients. There's a lot of excitement about the cloud, but there are a lot of considerations that must take place before you commit to cloud data centering. So let's talk about a couple of those real quick. First of all, complexity. Owning a customer-owned data center allows you to customize your applications. It's very flexible. We can service accounts with different programmings. We can handle unique services much more easily than we can with a cloud-based data center. However, on the flip side, some pre-planning does have to go into a data center design. Once you build the data center, it's pretty difficult to add cabinets and equipment and storage devices, so you do need to have a lot of pre-planning. One of the gentlemen here on the panel, I nodded my head when he talked about planning for the IT infrastructure before the building is constructed, and that is an excellent practice. The trend is towards intelligent buildings. We want LED lighting, monitoring, building automation services to all run over the structured cabling. This means that you have to have designed your data center and scaled it appropriately to support these services. Data speed and retrieval, much faster if you own your own data center. So you want to own a data center if you're doing any of this medical outsourcing, diagnostic reading, and so forth. Also, we need to keep in mind that the customer-owned data center is much more secure. If you have initiatives for security, it's much easier to prohibit a data breach if you own the data center. In the cloud, there are multiple access points, much less secure environment. Cost is something to consider. The cost to manage and run a data center is about 10 to 20 million US dollars a year. So these data centers are not cheap. However, the advantages they offer in terms of speed, security, flexibility to offer services can pay for themselves depending on the type of operation you're running. So what does it boil down to? A customer-owned data center is best for large, complex facilities, hospital environments, and so forth. A cloud-based system makes sense for single, smaller service offices, perhaps clinics. So please, if you're in a large facility, there are many benefits to having a customer-owned data center in terms of application, security, and storage. So I talked very quickly about the need to support application files that are very large. I talked about the importance of a capable structured network system. So let's boil down what those network components must consist of. So in the horizontal, that area connecting to devices, the correct grade of cabling, the minimum grade of cabling to support 10G base T, the higher rates of transmission is category 6A. If you take one thing away from the seminar today, it's that your network connections at the device must be category 6A rated. And a better solution is a category 6A shielded solution. Those shields are more capable of supporting remote powering applications such as LED lighting, such as security cameras, such as voice over IP phones. And shielded offers the benefit of immunity in environments where medical equipment may cause interference. There are multiple standards, structured cabling standards that are written for the healthcare environment, and they recommend category 6A as a minimum for all new healthcare facilities. There are areas in the cabling plant where multi-mode fiber and single-mode fiber make sense. This is typically backbone connections, the core of the data center. The recommendation there is if you are deploying multi-mode fiber, which is really limited by length. So any length less than 100 meters, the minimum grade is optical fiber multi-mode grade 4, OM4. You can use single mode for longer length applications. One of the reasons you would try to avoid doing that is single mode equipment is quite expensive. So minimum grade of optical fiber when you deploy it, OM4. So let's put this all in one slide. I talked about money. Money drives everything. So on this slide here, you see the cost of downtime and slow time as a relation to what percentage your network is down. So downtime means a link just doesn't work. Slow time means it's not the correct category of cabling, or you don't have the faster switch technology that you need, and you've got doctors and nurses that are standing around waiting for technology. 3 nines, that bottom tier, that means you're up 99.999% of the time. It's only achievable in the highest tier of data centers, not anything that folks in this room will ever hope to achieve. That translates to about $49 in lost revenue in the India market. This is all scaled for the India market. What we typically see in the healthcare vertical is uptime 98 to 99% of the time. That's really the best you can achieve. And if you experience that level of downtime, you have the potential to realize almost $1 million a year in losses. If you're experiencing downtime, each doctor loses a minute, a meeting, a minute, a surgery, you can expect these numbers to triple or quadruple. In a ring of the environments that we're looking at, we might be seeing 20 different devices in each work area, each needing its own cable. That's why I proposed that the IT spend is not enough. It needs to double to support this level of technology. Healthcare systems are extremely complex, but the very good news is there are mature structured cabling standards in place that will reinforce the information that I just delivered to you now. And when in doubt, there are cable partners and there are allies that can provide design assistance in accordance with these industry standards, as well as provide warranties guaranteeing support of 10G-based, which will ensure that you will not experience loss of revenue due to downtime. So I tried to pack in a lot of information in 15 minutes. If anyone has any questions, please feel free to come see me at the lunch break. There are substantial online resources that are available at our website. There are substantial case studies related to successes in the healthcare vertical market. And these successes are based on picking the correct grade of infrastructure to support the IT technology demands of today, tomorrow, and all the way up to 2020, when you folks will have 3 million hospital beds in this country. Absolutely amazing. Thank you for your time. It was a real pleasure to be here.